Hello everybody, Kerri Evelyn Harris here from the small but mighty state of Delaware. Today we're going to talk about something specific to Delaware, but everybody from other states, if you're following and have an issue that's similar, please let's connect and figure out how we can work going forward. I'm here today with Dustyn Thompson from Delaware United. If you haven't heard of Delaware United, you need to. They are amazing at making sure that we are all educated on policy issues in depth. In my opinion, I feel that it is unbiased, but just giving us the facts, and I think that's something that is necessary. But today I'm here with Dustyn because he was very much involved in following the study group set in place to talk about a Medicaid buy-in program here in the state of Delaware. It didn't go much the way that I expected it to, and from my understanding, not the way that Dustyn expected it to go either. And so we just wanted to educate you, get you on board, and hopefully have you at the table as we discuss how to move forward after these meetings. So, Dustyn, thank you for coming and speaking with everybody. Sure. Can you speak to us about what you saw happen with the Medicaid buy-in study group and kind of your feelings about what happened and why it happened?
Sure. Yeah, so the study group was set forth in a Senate resolution from now retired Senator Margaret Rose Henry. Mm-hmm. And the goal was to look at what it would be and to clearly define what it is to have a Medicaid buy-in program, which is essentially a public option, mm-hmm. but on the state level. So it's the only program where there's a kind of a joint effort between the state and the federal government. So we can control a little bit of how we run the program, Medicaid. So they wanted to look at in the first meeting what the goals were underlying or underscoring the need for a Medicaid buy-in. Mm-hmm. And so they talked about affordability and access to care and the hot issues that we hear a lot about. Right. So it came down to kind of how can we best solve those. So the study group only had, I believe, 6 or 7 meetings.
Wow. Okay.
And so
over what period of time?
So it ran through the summer, and then they had their last meeting earlier in December, earlier this month. So the first couple meetings were a little bit more compact, and then they spread out a little bit more as we needed more time to. Mm-hmm. Well, the group needed more time to look and review the reports that were being given to them about the costs of insurance in Delaware and what different possible solutions to help bring down the costs would look like. So it kind of was decided a little early in the study group's meetings that it wasn't going to likely be possible to come up with, agree upon, and implement or try to implement basically an entirely new insurance system.
Right.
So they really wanted to look at those underscoring issues. Particularly they honed in on affordability because that really is you have access to care, but if you can't afford it, your access doesn't matter.
Absolutely.
So they kind of switched gears away from looking at like a true Medicaid buy-in, which can go 2 ways. Either it can go and expand Medicaid even more than we did in 2014 when we expanded Medicaid under the ACA. So we could expand it to even higher income levels. That would put in a very large, tens of millions of dollars burden on the state, right. Because you're not asking anybody to actually pay for it. You're just giving it to them. So that was kind of right out because we just don't have $80 million right. to add on to our already ballooning healthcare budget here in Delaware. So the other option was to create a product that looks like a more private plan, but operates with the purchasing power of Medicaid.
Okay.
So Medicaid is a huge number of people in Delaware. It's definitely the largest risk pool that there is in Delaware. So the purchasing power is really high, so they can negotiate a lot, which means you could create a plan for pretty decent price, but you would have to change some things from traditional Medicaid and probably have to do things like cost-sharing measures like deductibles or co-payments to really make it super affordable.
Right.
And then there came issues with Blue Cross, who, unfortunately, in my view, was on that study group. I understand, but how likely were they to agree to a Medicaid buy-in?
Right.
So they raised concerns about stability in the marketplace, which one could argue is not stable now.
Right.
But that's a whole nother topic.
Yes.
So
just to be clear, Delaware is down to one insurer, correct?
Blue Cross Blue Shield for the individual marketplace.
Okay.
If you go through your employer, they might be purchasing insurance in a big group like Costco does.
Yes.
So it might be a different company.
Okay.
But yeah, if you're going out, like you or I were going out and buying insurance
Yes.
on the exchange, it'd be Blue Cross or nothing.
Gotcha.
And so they decided to go a different way and look at what's called a reinsurance program, which a lot of states have implemented now, a number of states, I shouldn't say a lot, to help bring down the cost of their insurance. So like Alaska was able to bring it down around 20%, I believe.
Okay.
Maryland was able to bring it down closer to 30%, I believe. And so the discount there, the possibility of savings is fairly large. So basically a reinsurance program takes kind of the riskiest people out of the risk pool, or the high dollar claims out, and that insurance program covers those claims. So then the private insurance industry can say, oh, we don't have to worry about that, so now we can lower our rates.
Right. When we're talking about, so some people don't understand, when we're talking about high risk pools, people with what kind of
So
issues?
your risk pool is ultimately what determines how much your coverage is.
Right.
And that's why Delaware's insurance is so high, because our risk pool is small, meaning we have a small amount of people in the individual marketplace.
Okay.
And we have a high population of seniors.
Okay.
And after you get past 55, your health care generally goes up in cost for the insurance company. You generate more claims.
Whether it's high cholesterol, diabetes,
anything,
heart disease.
yeah.
Okay.
Life has a way of catching up with you.
Absolutely.
So given that we have a high aged population mixed with just a small amount of people in the individual market, that's why our costs are so high, because it's a high risk pool and it's small.
Got it.
And so manipulating the risk pool by taking out the most high dollar claims could potentially generate a significant savings. The question just comes down to, how do you pay for it?
Yes.
And that was kind of the last quarter of the meetings, was they talked about really honing in on that reinsurance program, how they could implement it, what was needed to be done, how much is it going to cost, and how do we pay for it.
Right.
And that's when the meeting started to really, for me, take a turn.
Yes.
Because we heard about how other states paid for it, and it seemed relatively fair, just, I guess. So they had, for example, Maryland capitalized on the fact that the federal government said, well, we're not going to do this fee that's embedded in the ACA for insurance companies, but states, you can still charge that fee and keep the money to fund these reinsurance programs. And Maryland did that, and they generated all the money they need for their program for the next 4 years.
Wow.
And the idea is that by then we'll have a solution in place for really handling the insurance crisis. Well, that window has closed, or will close next year. It's possible that the federal government will continue to waive that fee and allow states to continue to do this. But, we don't want to rely on that.
Yes.
The study group didn't. The other option was to put in an assessment on policies themselves. So basically telling some policyholders, your rates are going to go up 2%, but it's to pay for a program that's going to bring them down 30%.
Right.
So you're going to get a 28% net savings. So the average policyholder isn't even going to see that increase. They're going to see a decrease.
Right. And I want to key into that portion. It wasn't what was decided, but it's something we can push. There will still be savings. The difference is either 30% or 28%. So as he goes on, keep that in mind for those who could possibly see savings.
Yeah, and that really is, I think, the most fair. You're asking people who are directly benefiting from the reinsurance program to help fund the reinsurance program, and still giving them a savings.
Absolutely, a significant savings.
Yeah, and those numbers are rough, but that's just a general idea.
Right.
So whatever the cost of the program would be on that assessment, it would be less than the savings accrued.
Right.
So those numbers aren't solid numbers. It's just an example.
Yes.
So the third option, which New Jersey is looking at implementing, and what the study group is now going to be recommending to the legislature, was the individual mandate.
Okay.
So last year, the federal government got rid of the individual mandate, which was a double-edged sword, because those fines, it was a tax, was put in place to fund the subsidized health care. So those who couldn't afford it were made more able to afford it through people who also couldn't afford it paying a fine.
Yes.
It was a very convoluted thing, but now that you've taken that mandate away, the funding for the subsidies is in danger as well. But in either case, they're talking about re-implementing it on a state level.
Okay.
So Delawareans paid over $8 million for not being able to afford insurance, or outright refusing, last year. So they want to take that money and use that for the reinsurance program. So again, framing, I think, is important. You're taking money from people who can't afford health care to help the people who can afford health care to be able to afford it more.
Yes.
Which, I don't know, to me that sounds
Can you say that one more time?
So
Look people in their face and tell them,
So we're going to take money from people who can't afford health care to help fund a program to help those who can afford it even more.
Yes.
Does that make sense? I mean, I know that doesn't make sense.
It makes sense, but like you said, but it doesn't make sense.
So that's what we're going to be recommending in January.
Yes.
And there are other options for funding, and there's a way to do so Massachusetts, who has over 1,000 plans, unlike our 3, and over hundreds of insurance carriers as opposed to our 1. So their insurance is a lot more affordable.
Yes.
But they have a mandate, but they tier it. Right, so the mandate doesn't kick in until you're in the upper income echelon. So where you can afford health care, you're just refusing to buy it.
Yes.
Which that's one discussion.
Yes.
But in Delaware, when premiums on average are $400 or $500 a month, and then you got massive deductibles on top of that, your federal poverty level guidelines would have to be pretty high to make it so that that's still fair. Because if you can't afford it, you shouldn't be fined for not being able to afford it.
Exactly.
And so it's up to the legislature if they move forward with the mandate as suggested under the federal guidelines, which that would be fining people who legitimately could not afford it.
Yes.
That's what the feds were doing in Delaware because that was a blanket mandate.
Yes.
And so if we go that route, that's not good for working families.
It's not.
As an example, my wife has health coverage. When she was in her last job, they did not offer spousal coverage.
Oh, okay.
And so on the marketplace, they take into account household income. Well, with her, I make pretty small amount. I technically would probably qualify for Medicaid if I was single. But because of her income, our household income was as such, we get any subsidies.
Yes.
So there was no cost sharing from the federal government to help us afford it. So the premium for me would have been around $500 with a $9,000 deductible.
Wow.
And because her income was taken into account, I got fined $1,800 for not having insurance, but we didn't have that money.
Yes.
Right? So so there's really some major glitches in the idea of the mandate, and I am very much against it and will be organizing against a mandate. We'll see what direction the state legislature takes it.
Right. In hearing Dustyn's story, there's a couple of things that stand out. One, those of you who know me know that I do not make a lot of money, and so I consider myself lucky. I was medically retired from the military when it happened. I didn't feel so lucky, but in what we call the civilian world, the cost of medicine is so expensive. Medical coverage is so expensive. I spend about $54 a month for my entire family to be covered. I know that there were times when even that was too much for me to handle. And so hearing things like $500 a month, huge deductibles, this is something that is painful for too many people. And I know I'm preaching to the choir in many respects, but this comes on, this addresses so many issues in our society. And this is something that can reach across party lines, because when I hear Dustyn say he could qualify for Medicaid if he wasn't married, and we're hearing people complaining about people not being married, there's an incentive to not be married to live. Yeah. And we've heard over and over again people divorcing just so that they can live, right? But how does that affect families going forward? In addition, the burden of taking an additional $1,200, $1,800 a year from a family is painful, very painful. It might equate to $100 a month or a little bit more, but $100 a month for the majority of us is significant. It makes the difference in buying a vehicle, heating your house, the food that you eat, and all of those also affect your health, all of those stresses. And so we need to find another way. We know we can find another way, but it takes voices, multiple voices speaking in unison, saying we want to make sure all of us raise up together, that we all should have health care that is affordable and not simply accessible. And this is a first step for the state of Delaware to be able to do that. And so Delaware United is, I know that I just heard that there's going to be a forum put on. We're working on organizing a forum around just the concept of healthcare in Delaware and just in general. It's a hard system to wrap your head around. It's so convoluted, and certainly a single payer system would be much easier to wrap your brain around. But we kind of have this hodgepodge that's really hard to understand. So just an educational event. Okay. And from my understanding, end of January, beginning of February. So as you follow Delaware United on Facebook
and Twitter. Okay.
Follow them for a number of areas, but specifically in this, once the forum is announced, I'm sure they will announce it on those mediums as well. And again, creating the statewide health care committee here in the state, which will cover every single county and people being involved. We have to make sure we are heard, and we can only do it if you share your stories, if you're willing to help knock on doors, write letters, show up in the General Assembly to speak and share your stories with those who write the laws. Let them know that you are not okay burdening the less fortunate, so that perhaps you can get ahead. Or if you are part of those like myself and even Dustyn, who just by the blessings that we have from our extended family are able to just barely squeak past those levels, we need you to show up. We can't change things by screaming on our own. We need you there with us, but they will listen, and we can change votes, and we can change the system. Is there anything else that you want to add?
No, I think that the study group said that they were not able to look at that issue entirely. So the hope is, and with your help, we'll get another group going that really looks at the cost-sharing measures and how we can make a public option affordable in Delaware to really drive competition. Right. And that will it's not over. No, it's not. It's just starting, more or less. So get on board. Let's make this happen, and we can celebrate at the end when more of us are living healthy lives. So, thank you, Dustyn. Thank you. All right.